What's up, everyone? Welcome back to Shock Doc Medical. I'm Dr. Raad, and today we're diving into something that might make you see the sun in a whole new light. Have you ever wondered why some people break out in a rash or get sunburned even when they're just sitting by a window? Well, that's photosensitivity for you, a condition where your skin reacts abnormally to sunlight, filtered light, or even artificial light. And trust me, it's more than just an overzealous tan. Today, we're getting into the nitty-gritty of taking a detailed medical history when a patient presents with photosensitivity. Whether you're a doctor trying to nail down a diagnosis or just a curious mind who wants to know what goes on behind the scenes, this episode is packed with all the info you need. So, let's break it down. Photosensitivity is defined as an abnormal cutaneous response that occurs when photosensitizing substances in your body interact with sunlight or even filtered artificial light. Essentially, if you're photosensitive, your skin is super prone to burning or developing a rash when exposed to light. And get this, it's most often an acquired problem. That means you might not be born with it. It could be triggered by something new, like a drug or even a topical agent. And sometimes conditions like atopic eczema or psoriasis can actually get worse with sun exposure. Weird, right? Now, for all my fellow docs out there and anyone interested in the detective work behind medicine, history taking is where the magic happens. When a patient presents with photosensitivity, you've got to ask the right questions to get to the bottom of it. Here's the rundown. Onset. First, ask, at what age did the problem start? It helps you figure out if this is something lifelong or a new development. Medication and topicals. Next, were any drugs or topical agents started before the onset of the problem? Most cases pop up within 6 weeks of starting a new drug. But here's a kicker. Even if a drug was started in late autumn, the rash might not show up until the next spring or summer. Symptom details. Dive into the symptoms. Ask, do you experience itching, pain, or a burning sensation? And if there's a rash, get specifics. Its distribution, appearance. Is it red, swollen, blistered, or pigmented? Timing and duration. Find out, how quickly does the problem occur after light exposure? And then, how long does it last? Minutes, hours, or days? Also, check if the rash leaves any pigmentation behind once it fades. Seasonal patterns. Ask about the seasonality. Is there a particular time of year this happens? Typically, symptoms kick off in the spring. Exposure specifics. Get granular. What kind of exposure triggers it? How much exposure is needed to cause the rash? You can even ask, does the rash appear with sunlight in the UK or only when you're abroad? And a fun fact, UVB, unlike UVA or visible light, can't penetrate glass. So ask, does it happen when you're near a window or driving? Other exposures. What about sunbeds? Does lying on a sunbed, which uses UVA, trigger your symptoms? And ask if there's any evidence of hardening. Does the skin become more tolerant after repeated exposure? Sometimes, paradoxically, the rash might actually improve as the summer goes on. Protective measures. Check if they've tried anything to mitigate the issue. Do antihistamines, sunscreen creams, or protective clothing help? Now, while the article doesn't specify dosages, if we're talking antihistamines, many clinicians might start with something like cetirizine 10 milligrams once daily. But of course, treatment should always be individualized. Impact and history. Finally, ask, what impact does this have on your quality of life? And dig into their past. Is there a history of skin cancer? Have skin cancers occurred at an earlier age than expected, given your skin type and sun exposure history? Also, inquire about hobbies, occupations, and any family history of photosensitivity. Now, let's talk classifications. The article breaks it down into two main types. Primary photosensitivity, rare. This includes idiopathic photodermatoses, cutaneous porphyrias, and the super rare genophotodermatoses. Acquired photosensitivity. This is where most of the action is. It can be due to phototoxicity or photoallergy. Phototoxicity is the common one. Think of it as an exaggerated sunburn. The common culprits here include phenothiazines, amiodarone, thiazides, yep, those common blood pressure meds, non-steroidal anti-inflammatory drugs, NSAIDs, quinine, tetracyclines, sulfonamides, retinoids, psoralens, vemurafenib, voriconazole. Photoallergy tends to present as an eczematous, scaly rash that might not show up on the first exposure. Here, the key offenders are sulfonamides, phenothiazines, thiazides. And there are other interesting categories too. For lupus erythematosus, drugs like hydralazine, procainamide, and thiazides can be the culprits. In pseudoporphyria, we see drugs such as furosemide, nalidixic acid, amiodarone, ciprofloxacin, bumetanide, and NSAIDs. Lichen planus, which can be photoaggravated, is also linked to thiazides and quinine. And finally, pellagra, associated with isoniazid. This detailed breakdown is essential for understanding which medications or exposures might be behind a patient's photosensitive reaction. Now, why does all this matter? Imagine you're a patient who suddenly develops a rash every time you go out in the sun. Not only does it affect your day-to-day life, but it could also be an early warning sign of something more serious, like skin cancer. For us as clinicians, a meticulous history can make the difference between dismissing a symptom and catching a potentially serious condition early. When you ask the right questions about the onset, triggers, and the exact nature of the symptoms, you're piecing together a puzzle. This isn't just academic, it has real-world implications. It informs us whether the reaction is drug-induced due to contact with something like a soap or perfume, or maybe even from something like phytophotodermatitis from plants containing psoralen. And hey, if you or someone you know has dealt with unexplained skin reactions, knowing these questions might just help you figure out what's going on or push you to ask your doctor the right questions. So, to sum it all up, photosensitivity is an abnormal reaction of the skin to various types of light, often triggered by drugs, topical agents, or even environmental exposures. When taking a history, dive deep. Ask about the onset, symptoms, exposure types, protective measures, and the overall impact on quality of life. And don't forget to consider the types of photosensitivity and the specific drugs that can trigger these reactions. Knowledge here isn't just power. It's the key to proper diagnosis and management. If you've enjoyed this detailed exploration and found it useful, whether you're a healthcare professional or just a curious soul, smash that like button, subscribe to ShockDoc Medical, and drop your thoughts or questions in the comments below. Let's build a community where we all learn and help each other navigate these medical mysteries. And hey, next week we're diving into another groundbreaking topic that might just change the way you think about everyday health issues. Until then, I'm Dr. Raad, reminding you to stay curious, stay informed, and always protect that skin when you step out into the sun. Catch you next time.